Sources close to a matter in which an elderly woman died at the university hospital have since reacted to recent media reports on the incident now under investigation. The sources wish to remain unnamed given the sensitive nature of the case, says it's only fair to set the record straight about the patient's care prior to her passing. Neika reports.
It was only this month that the health minister ordered a high-level probe into the circumstances surrounding the death of a patient who was briefly housed at the Falmouth Hospital in Trelawney. However, that patient, according to highly placed sources, was never a patient of the Falmouth Hospital and was only granted space there while being treated by doctors at the Cornwall Regional Hospital. When asked why the patient would be granted a bed at Falmouth if she was a patient of CRH, one of 3 Type A hospitals in the country, the sources ventured further. One advised that the patient was taken to the Type A facility to facilitate a neurosurgical operation, reminding such resources are not typically found in Type C facilities like the Falmouth Hospital. However, when the renovation of the main Western Regional Health Facility began several years ago, a decision was taken to use a section of the Falmouth Hospital to house some of their special care patients. Such, it was alleged, was the case when this elderly patient was brought in. However, it said that ward could not facilitate the patient, and she was instead brought to a bed elsewhere on the facility on another ward. Sources say the ward she was brought to was an interim measure to facilitate her transfer either back to the CRH, where the surgery could be done, or the next option to the UHWI, the other Type A hospital. Sources insist not only did CRH doctors tend to that patient as their own, but added the only time Falmouth doctors offered care was upon the instruction and advice of those from the CRH, which they insist was on the rare occasion. It's why they are now irked by media reports suggesting the patient died at the Falmouth Hospital, which they remind is simply not true. This as the patient was transferred the Thursday from the Falmouth bed after finally granted space at the UHWI, where she was admitted 3 days before her passing. The patient's relatives have since taken to social media demanding justice for alleged poor treatment and negligence at the Falmouth Hospital, which the sources say is unfair. And concerning claims that the patient's medication was stolen by the staff and sold, one source vehemently shut it down. The source says instead the medication was packed into the patient's bag for transfer to the Cornwall Regional Hospital. But after delays in the transfer, she allegedly missed a dose. It's understood checks were made. The medication was indeed found in the patient's bag and another dose administered. The incident forms part of several investigations now ordered expedited by the Prime Minister amid much criticisms and calls for heads to roll. Neika, CVM News.